We are in for a wonderful segment this evening.
Okay.
As told by the amount of interest and attendance we have tonight, so we're really excited to be here. We certainly know supplements are a really hot topic,
Yep.
in our community, in the cancer space, just even when we talk about nutrition in general. So we're so excited to have a fellow dietitian here with us tonight, just imparting her expertise and her knowledge about the world of supplements and how they can play a healthy role in your overall approach to wellness and health and your nutrition. So we're really excited to be here for National Nutrition Month. And I am so excited to be here with my amazing colleague, Aubrey. So let's introduce ourselves. So my name's Erin Pellegrin. If you've joined our education segments before, you probably have seen me. I am part of our amazing dietitian team and so excited to be here with one of my esteemed colleagues.
Yes, and I am Aubrey Red. I am one of the senior culinary dietitians here on the Unite for Her team. I know I have talked to many of you and seen many of you on our cooking classes. And we're really excited, like Erin said, for tonight's topic and for National Nutrition Month in general.
And before we go any further, I do want to give a very quick thanks to our education sponsors. So digital education events are presented by our West, Merck, and Daiichi Sankyo. And we have additional support from Gilead Sciences, Lilly, GSK, Pfizer, and Agendia. And we are so grateful to their ongoing support for our UFH Connect network. They are incredible supporters of sharing science-backed information and education to our Unite for Her community. And we know that you so thrive on all of that. So we will continue to bring you events each and every month. A lot going on this month, a lot to look forward to. But first, I want to start with our really, really amazing segment that we have planned for you this evening. So I'll toss it over to Aubrey to introduce our expert for tonight.
Absolutely. And of course, like we said, it's National Nutrition Month. So we have a fellow dietitian, Alicia Gould, MS, RDN, CSO, CDN. Alicia is a level 3 clinical dietitian nutritionist at Memorial Sloan Kettering Cancer Center. She provides nutrition care to individuals with cancers across all disease types in the inpatient and ambulatory setting. She has a particular interest in the nutrition care of surgical oncology patients. She received a Master of Science in Nutrition through SUNY Brooklyn College and is both a certified specialist in oncology nutrition and a registered dietitian nutritionist through the Commission of Dietetic Registration. So please welcome me in joining us, Alicia Gould.
Hi, everyone. Thanks for having me. I'm so excited. Happy National Nutrition Month. Happy National Registered Dietitian Day yesterday. So, this is really exciting. I'm really looking forward to sharing my, expertise and definitely, excited to be answering some questions and making this very conversational. My title is The Truth About Supplements and Cancer. And, I'm really excited. Thank you again for the warm welcome. So let's jump in. So today's learning objectives, I will be discussing what a dietary supplement is and giving a broad introduction to what they are. We will discuss what we do at MSK, what our recommendations are for cancer prevention, for during active treatment and beyond. And then I'll provide you with some reliable resources for you to reference for future use. So, with that being said, what is a dietary supplement? I think that we all have a ton of different ideas of what that might be, but according to the FDA, dietary supplements are a product intended for ingestion that, among other requirements, contains a dietary ingredient intended to supplement the diet. And I'm emphasizing supplement because that's what they are supposed to do. They are not meant to replace the diet. And I think that that's really important. And I will likely be repeating that throughout the remainder of our conversation about supplements. So what I did here was broke down common supplements into subgroups. Vitamins and minerals, I think most people are familiar with. You could have a supplement in an individual vitamin, like vitamin C or biotin, which is a B vitamin. It could be a combination of different vitamins in a multivitamin. And then you might have a deficiency in iron or maybe calcium and take a supplement that way. So the vitamins and minerals, I think, are pretty straightforward. Then we move into the botanicals and herbs, as well as the botanical compounds. So some herbs that you might be familiar with include echinacea and ginger. And then some compounds are caffeine, as well as curcumin, which is what's found in turmeric. Um, so those four botanicals in my field, I find are, definitely buzzwords, especially turmeric. You might, you might feel the same way. And then the last two subgroups are amino acids, which are the building blocks of proteins. So glutamine and tryptophan could be supplemented. And then live microbiota, another really buzz, topic right now, are prebiotics and probiotics. Okay. So there are a variety of reasons for taking supplements. Before buying or taking any sort of dietary supplement, I really do recommend talking with a healthcare professional, whether it's your doctor, a nurse, a registered dietitian, or a pharmacist even. That way they can guide you in the right direction and make sure that you're taking something that's truly necessary. So, number one reason, you might be deficient in an actual nutrient. You might be deficient in calcium or iron. You might notice that you have low energy levels, and after having blood drawn, your iron's low. So you need to supplement with an iron pill. Or maybe you're deficient in vitamin D, like most of us in the Northeast. We receive the most active form of vitamin D through the sunlight. And thank goodness we're turning that corner. I can taste summer, but the days have been short and dark. So our vitamin D might be low and need supplementation. Pregnancy is another big one where supplementing is important. During pregnancy, it's of course important to make sure you get all of the nutrition that's important for the fetal growth. So most of the time, a prenatal vitamin, I should say all the time, a prenatal vitamin is recommended, and that will include everything that the fetus needs for optimal growth, including omega-3s, iron, folic acid, and usually vitamin D, amongst other things. After a weight loss surgery, that's another big one where after surgery, our bodies and nutrients are absorbed differently, and you might be at risk of becoming deficient in B12, iron, vitamin D, or calcium. And it's usually recommended to supplement with a multivitamin or a bariatric vitamin in specifically. Drug or alcohol use. There's something what's known as Wernicke-Korsakoff syndrome, and this is associated with moderate to severe alcohol use and is oftentimes the result of a vitamin B1 or thiamine deficiency, where again, that would be necessary and appropriate for you to be supplementing with that specific vitamin. And then a vegan diet. Just, I don't want to call it a restricted diet, but oftentimes if it's not properly planned out, people could become deficient because they are eliminating different food groups. So you might consider taking a multivitamin there. Okay. So like everything else, there are reasons for and reasons against. So here are some arguments against supplements. In various studies, well-nourished people are the ones often taking the supplements and adding excess nutrients to sufficient intakes. People who already have a diet that is really colorful and tons of different variety could end up taking in too much of a specific nutrient. And on the flip side, people usually with a low nutrient intake from food generally do not take supplements. Supplements, again, are a supplement. They cannot take the place of a nutritious diet. So, I educate my patients on just general nutrition, healthy eating. The more color on the plate, the better. And we'll get into some of those recommendations further down this presentation. Also, supplements can be costly and harmful to health. Again, if you are already have sufficient nutrient stores, adding more to stores that are already in place and at their max could pose some potential harm. Um, and then lastly, which I think is really important to remember, is that foods rarely cause a nutrient imbalance or toxicity. I've never met a patient who became uh, a toxic effect from overeating carrots from vitamin A. That just doesn't happen, but supplements can easily do that. So the higher the dose, the greater the risk. So some benefits, I wanted to, of course, play both sides. Benefits, it can, of course, improve or maintain your overall health. I think, the reasons why patients take them was I laid out pretty clearly. And then, it can meet your daily requirement for essential nutrients. Like we said, whether you're pregnant and need some prenatal vitamins or you're deficient in magnesium, these are reasons why and can be helpful. Of course, the risks. Many have ingredients that can have strong effects on the body. A lot of supplements may interact with medications that you're already on, maybe different labs tests or dangerous effects during surgery. Or it could lead to a bad reaction or side effect, otherwise known as an adverse event. So, again, like everything, you have to weigh your benefits, the risks, the pros, the cons, all of that. Okay. So I think what's really important to review is how supplements are regulated. The FDA does not have the authority to approve dietary supplements for safety and effectiveness or approve labeling before they're sold to the public. That's something that I really drive in as a reason why patients, especially going through active treatment, should be careful with supplement use during treatment. Again, we'll touch on that later, but because the FDA doesn't have the right to, really approve it, it makes me a little cautious with all of the treatments, chemo, immunotherapy, hormonal therapy that they're going through. So it's the responsibility of these manufacturers and dietary supplement companies to ensure their products meet safety standards for supplements and are not otherwise in violation of the law. So every dietary supplement label looks like a food label on the pill box. And it's required to have the nutrition information in the form of a fact label. Again, similar to a food label. So it'll have the serving size, number of serving size per container, list of all the dietary ingredients in the product, and amount per serving of those ingredients. Okay, so here are some tips for selecting reputable supplements. And I put some images here. I think a lot of us are familiar with Nature Made or have seen it, and same with Centrum. These are reliable sources. A lot of the supplements have to list what is supplement contains what's stated on the label and in the amounts listed. Products need to be standardized. Supplements, of course, should be free of harmful levels of contaminants and other potential drug contaminants. Um, and then product doesn't contain any undeclared ingredients. So a lot of times these supplement companies are not required to do any third-party testing. However, lots of different manufacturers, like a Nature Made or a Centrum, voluntarily to undergo testing to show good faith and commitment. So some of the third independent party companies, such as USP or NSF, the labels that are on the top row, those three, if you see those on any label, it's likely a reliable source and reputable. So I just wanted to highlight that because, again, it's important to make sure that we are either recommending or, purchasing for ourselves in products that are not going to put us in danger. Okay. So I just wanted to put these two like titles, headers, so to speak, up for you guys. So the first one is the National Center for Complementary and Integrative Health by the NIH. of course, this is a place where you can go do some research about different botanicals, herbs, supplements, things that are out there. And then MSK also has our own website page through our integrative medicine department, open to the public, but really goes through A to Z of any supplement. I'm using that in like a broader term that you can think of, and what it's used for, what it could interact with. So also really, reliable resource to check out. Okay. So, tips for being a safe and informed consumer. Like everything, whether it's a medication or a dietary supplement, make sure that you take only as prescribed on the label. Do not substitute a dietary supplement for a prescription medication or for a variety of food important to a healthy diet. Again, it's a supplement, it is not meant to be your iron source. um, don't assume that the term natural to describe a product is considered safe. I have so many people who ask me, I want to follow a natural diet, or, this is a natural product. I don't know what that means. There's no definition for it. So, even though when we think of nature, we think of it as pure and clean, in the supplement world, in the medical world, don't assume anything. Be wary of hype. If something is too good to be true, it likely is. And then last but not least, learn to spot false claims. I kind of tied that similarly into the be wary of hype. If somebody says you're going to change your, lab values overnight by taking X, Y, or Z, I don't know about that. Um, so, be smart, be informed, do your research, bottom line. Okay. So now I'm going to go into the use of dietary supplements in the oncology setting and starting with cancer prevention. So, the World Cancer Research Fund and the American Institute of Cancer Research put out guidelines that are really in line with the 2020-2025 dietary guidelines for healthy Americans. This is aimed at the overall prevention of chronic diseases and focuses on promoting overall health, reducing the prevalence of overweight and obesity, and again, preventing diet-related diseases like cancer or heart disease or diabetes. So taking a look at this image, the recommendation, again, for the general public, but also our patients who are maybe at risk for a familial genetic disorder and are just hoping to, keep cancer at bay and are in that prevention stage. Fruits and vegetables, 2.5 cups or an equivalent per day for vegetables, and fruits, 2 cups or the equivalent a day per fruits. So what that could be is, a cup of berries and a banana, or a cup of broccoli and maybe, a half a cup of tomatoes and a half a cup of leafy greens. Grains, at least half of which should be coming from whole grains, 6 ounces or the equivalent per day. So then that kind of brings me to fiber, which is really important. The recommendation is 25 grams for women and 38 for men. Oil, coming from healthy fats like monounsaturated fats. So that can be also avocado oil, extra virgin olive oil, around 5 teaspoons per day. Proteins, seafood, poultry, should be around 5 ounces or equivalent per day. And we want to limit the amount of saturated and trans fats. However, the American Institute of Cancer Research recommends no more than 18 ounces of cooked, unprocessed red meat. And their definition of unprocessed red meat is like beef, pork, lamb. So if you wanted like a hamburger, or a pork chop, those are considered unprocessed red meats. They also recommend limiting added sugars. I think for women, it's from the American Heart Association, 6 teaspoons of added sugar per day and 9 for men. And then sodium, you want to stick to, depending on what website you go to, it's either 2,300 or 2,400 milligrams of sodium or less per day. And last but not least, probably my favorite group is dairy. Low-fat dairy, 3 cups are the equivalent per day. That could be coming from skim milk, 2% Greek yogurt, cottage cheese, or just regular cheese. Okay. So here is the American Institute of Cancer Research, their recommendations for cancer prevention, kind of like a blueprint cheat sheet. So one of the more important things that one can do to prevent cancer is maintaining a healthy weight, keeping it at a healthy range, avoiding weight gain in your adult life, avoiding yo-yo dieting. And the best way to do that is, of course, to eat a diet rich in fruits and veggies, whole grains, everything that I just reviewed, limiting the consumption of red and processed meats. Being active. This is something that I really stress with my patients. I am not a personal trainer. I am not an exercise physiologist, but I do know that walking 10 minutes a day is better than nothing. So just getting up, getting out, it could be a nice walk. If it's something that's a little bit more challenging for you, that's great, but just start somewhere. And then I start in red, if you can see, do not use supplements for cancer prevention. Aim to meet your nutritional needs through diet alone. So there's multiple times on the AICR website that says to avoid supplements for cancer prevention. All of your vitamins and minerals are its most active form through food. So that's what we encourage. Of course, you'll see at the bottom, I didn't say this, but no smoking or, avoiding exposure to tobacco, that's of course very important. So here is, again, the AICR's cancer prevention recommendations, but like some tips on how to put them into action. So again, a healthy weight, manage your weight with healthier foods. The AICR has an amazing website if you're not familiar with it, tons of recipes, really great frequently asked questions, foods to focus on, although there's no one food that will prevent or cure or keep you, you know, away from cancer, but there are definitely some that you can, try to incorporate more often than not. So, with that being said, whenever I review these recommendations, the 2025 dietary guidelines, or just start talking about eating healthy, patients get very overwhelmed. How do you put that into practice? So I always start with the My Plate. This is what we call My Plate. It has taken the place of the food pyramid from back in the day, where it was carbohydrates at the bottom. That was the base. You maybe had vegetables, and I think it was fruit, and you worked your way up to the tippy top, and that was the sugar and sweets. So here, this is a realistic way to increase your plant and fiber intake by making half of your plate coming from non-starchy vegetables and fruit. The more color on the plate, the better. If you're somebody who's starting out wanting to try to increase your fruit and vegetable intake, but don't want to measure it based off of the 2.5 cups of vegetables that I recommended, start here. This is also something that could be done out of the house. You don't need a measuring cup. You just need your eyes and a plate. So half of it, non-starchy vegetables and fruit. Non-starchy vegetables are tomatoes, leafy greens, broccoli, cauliflower, Brussels sprouts, asparagus, green and yellow zucchini. So that should make up the majority of the plate. And then if you move to the other half of the plate on the right side of this image, a quarter should be coming from grains, whole grains specifically. So that could be brown rice, it could be quinoa. You could do white rice. You could also do regular carbohydrates like pasta or starchy vegetables like potatoes and butternut squash and corn. The final quarter is your protein, animal and plant-based protein. And again, the recommendation for that red meat is unprocessed red meat, no more than 18 ounces of cooked per week. And then there's dairy off to the side. Um, it's important, it's especially important for female patients as we age, our bones become a little less strong. We need the calcium. It's also a great source of protein for my patients who are going through active treatment. It's a great way to not only get protein, but also probiotics to help with some of that GI distress. I'll get into that. But this is what we aim for. And then I think that this is a great little checklist. It almost feels like a game that you can try to play. And it just goes through a 30-day cancer prevention checklist. So, it starts with trying a new exercise. Maybe just try exercising. We don't need to do a new one. Let's just try moving our body. Or replace meat with beans or lentils. I think it was about a decade or so ago, Meatless Monday really became a big thing in the field of nutrition and just in like the media. So Monday, even if you can convert one meal, you don't need to do the whole day. Start small, set a realistic goal. One meal, not eating any animal protein, really makes a big difference. I know it doesn't seem like it, but it does. Or, again, kind of using the AICR website, the Unite for Her website and their recipes. Try a new lentil recipe, or replace rice with quinoa and check out recipes that have quinoa. More variety, the better. Okay. So now we're moving into supplementation for people who already have cancer, who are going through active treatment, whether that's chemo, radiation, chemoradiation, hormonal therapy, you name it. So there are some benefits. There's not a ton of research out there, really, either way, for benefits or risks, but we'll dive into it. So, some of the benefits are antioxidant use during treatment might protect normal tissues from side effects of treatment. It might improve tumor response and patient survival, and it often can be associated with symptom relief and symptom management. So, looking at this graph that I found from Mary Hardy et al., they looked at dietary supplements and the efficacy on cancer care. So I just starred some of them. I'm going to go through a few. The first one that I starred is probiotics in patients with biliary cancer who have undergone surgery, colorectal patients who are undergoing chemo, and patients receiving abdominal or pelvic radiation. So when these patients were supplemented with a probiotic, they found that there was lower post-op infection rates from those biliary cancer patients, decreased GI toxicity in the form of diarrhea, with less hospital care and less reduction in chemotherapy. And it also decreased the incidence of diarrhea. Zinc in head and neck patients during radiation therapy. This showed to improve stomatitis, which is swelling and redness in the lining of your mouth, making it really sensitive, difficult to eat certain textures, certain spices. So, zinc was shown to improve that side effect. And then last that I'm going to touch on is the fish oil. So fish oil in patients with cancer-induced cachexia, otherwise known as wasting syndrome. This causes significant weight loss and muscle loss, often seen in advanced cancer diagnoses. So at this point, when we see a patient who's cachectic, it's irreversible. The priority and goal is really just keep them comfortable, keep them, getting in as many calories and grams of protein that they can, and maintaining their weight. So when these patients used fish oil as a supplement, there was an increased dietary intake, maintenance of weight, and decreased fatigue. So I took a look at, like I said, a few articles and research studies. There weren't many, but the first one that I looked at was a review conducted by Block et al., and it looked at the evidence that was evaluating the effects of concurrent use of antioxidants with chemo on toxic side effects. So that was a mouthful, but antioxidants that were reviewed included glutathione, melatonin, vitamin A, vitamin E, and CoQ10. Um, the majority of the studies, which I believe was 24 out of 33, included evidence of decreased toxicities from the use of antioxidants along with chemo. 5 studies reported the antioxidant group completed more full doses of chemo and had less dose reduction than the control groups. And I see this all the time with our patients. They're not tolerating chemo well, they can't handle it, they're having terrible side effects, and they need to reduce the dosing of chemo. Patients get so worried and concerned that they're not getting the full strength that they need to, stop the cancer. So this is interesting. These antioxidants showed that there was, you know, support and evidence that it could be considered. Um, the second study that I looked at also um, looked at the effects of arginine and glutamine, which are amino acids, and fish oil supplementation for those going through chemo radiation. So the first one just looked at chemo. This is chemo radiation. And it looked at the ability to adhere to the full planned treatment regimen and those associated toxicities. Um, the results were significantly higher, um, showed significantly high rates of hematological toxicity. So those are blood toxicities in groups without supplementation compared to those that took the arginine, glutamine, and fish oil. And then the treatment completion rate was greater in the supplemented group, although not statistically significant, which is what we always look for in research papers. But then the 2-year overall survival was greater in the supplemented group. So now the risks. Antioxidant and other supplementation may interfere by reducing the effectiveness of chemotherapy and radiation. Skin sensitivities and reactions when taken during radiation therapy, specifically with antioxidants. And then for surgical patients, supplements may react with medications used during or after surgery, or may increase the risk of side effects such as bleeding. Let me just take a sip. Okay. So I wanted to touch on the bleeding risk and the associated supplements. A lot of people ask about the black cohosh, flax oil, gilgoa biloba, turmeric as well, and of course, vitamin E. Um, not only taking these supplements could increase your bleeding risk, preventing blood from clotting properly, undergoing surgery. Patients who are receiving chemo often have low blood counts, so it's imperative to be skeptical or wary of supplements that may increase the risk of bleeding or infection risk. And then cytochrome P450. It's a big old term that I hadn't thought about in years, but it's really important to understand when talking about supplementation and the risk during active treatment. There are certain botanicals and supplements that activate or inhibit this liver enzyme. That's what the CYP450 is. It's a liver enzyme that is responsible for metabolizing more than 35% of chemo drugs out there. So not only is it responsible for metabolizing those chemo drugs, when supplements like echinacea or grapefruit or St. John's wort then are involved, it really can interfere and increase the drug half-life and may lead to more side effects or contribute to increased toxicity. And it also can make the chemo drug less effective by reducing the half-life of the drug. So again, these are things that I have control over recommending to my patients, and my patients have control over. But like everything, let's take a little bit more of a look into the research and literature out there. So here are supplements and their interaction with certain chemo drugs. A lot of them you might be familiar with. A few here that I see all of these all the time, but the cisplatin, etoposide, irinotecan, methotrexate, those carboplatin and oxaliplatin, those are all every day I see my patients on them. So, for somebody who is on
And that's
cisplatin,
why
when they supplemented with N-acetylcysteine, black cohosh, and zinc, decrease effectiveness of the chemo. A top side, if it was supplemented with botanicals like the echinacea we spoke about earlier, it reduced the conversion to active form. Vitamin K and glucosamine reduce the effectiveness of chemotherapy. Okay, so here's some studies that I found, of course, that showed risks. The first study was an observational one. It looked at 1,100 high-risk, early-stage breast cancer patients who were followed for an average of 6 years. They looked at the intake of antioxidants, including ACE, as well as carotenoids, CoQ10, both before and during chemotherapy. And these people were more likely to have recurrence by taking these antioxidants. Vitamin B12, iron, and omega-3 fatty acids were at greater risk for recurrence and death, and a multivitamin didn't appear to affect the outcomes. So, I thought this was interesting. The increased risk of recurrence for not only the antioxidants, which there seems to be a lot more research on, but also just a B12, iron, and omega-3. The second study is a article that took data from 2,200 postmenopausal women diagnosed with breast cancer from 2002 to 2015, so over 10 years they were followed. And it showed that the intake of antioxidants, specifically selenium, again, vitamin A, C, and E, showed an increased risk of total mortality and breast cancer recurrence. And then the last study that I looked at, I thought was really interesting. And this looked at outcomes of breast cancer in patients who use alternative therapies such as diet, herbs, supplements, instead of standard practice and primary treatment. So these researchers did a chart review on individuals with breast cancer. And in those individuals who delayed surgery, chemotherapy, and/or radiation, 11 patients who refused the surgery, 10 developed disease progression. 3 patients who refused adequate nodal sampling, 1 developed recurrence. And then 10 patients who refused local controlled procedures, 2 developed local recurrence, and 2 died of metastatic disease. And just to highlight the alternative therapies that were taken by each group, I included that in the table. And for example, the 9 patients who refused chemo, they tried using herbal therapy, diet therapy, and CoQ10 as their primary treatment as the first line. So the takeaway here is complementary alternative therapies as primary treatment lead to an increased death and recurrence. So those are the studies that I found for, promoting the use of supplements and discouraging. But at the end of the day, I always tell patients, if you feel like you really want to increase your vitamin E or start eating more or start introducing probiotics to your treatment, sources of food are a great way to get those benefits. You know, None of these superfoods are considered dangerous in its natural form through food. So when patients come to me who have really bad diarrhea, I'll recommend a low-fat dairy product like yogurt. A lot of times those probiotics will help decrease the GI distress that they're feeling. Or for my patients who are going through cisplatin, which is a really tough chemo regimen on your kidneys, why not have them try some almonds in the form of vitamin E to decrease that nephrotoxicity? So these are just a few ways that I try to encourage patients to get their supplements through food. So I kind of touched on it, what do we recommend to our patients? I feel like I kind of now am showing a little bit of my bias because I don't recommend supplementing during treatment. I always tell patients, please discuss with your healthcare team, the medical team, your oncologist, your radiologist. Everybody really is individualized at MSK, and we don't look at it as a cookie cutter treatment plan. But for patients who are actively going treatment, we recommend a healthy diet as able. Plant-based, focus on those fruits and vegetables, but of course, incorporating lean animal protein. We want to make sure our patients are getting in the proper calories and protein to maintain their weight and also keep themselves hydrated with a goal of 2 liters or more per day. So that's 64 ounces. Food safety is also really important in our population. Their immune system is just so weakened that we don't recommend raw fish or raw meats during any sort of treatment. So, no sushi, no rare steak. Everything needs to be cooked to the proper temperature. Of course, separating produce from raw animal protein, things like that. Managing side effects is what I do 90% of my day, helping patients get through treatment and reviewing oral nutrition supplements with them, which are different from dietary supplements. So here are some symptom management recommendations that I review with patients. And again, I kind of broke them down into different buckets. So eating and drinking is the most common symptom that patients suffer from. They have a loss of appetite, they're nauseous, maybe they're vomiting, mouth soreness and pain or dryness and thick saliva or mucus. That's a lot of times associated with head and neck radiation, as well as swallowing problems. Um, so, starting with liquids, some patients just have an easier time drinking them. So, these oral nutrition supplements like Ensure or Boost are encouraged for patients to drink. It's a quick, easy way to get calories and protein. They're shelf stable. So, I usually will suggest patients take them for the day if they have lots of different um, doctor's appointments or they're going to be in treatment for a long time. And then just like bland, easy to digest foods if you're nauseous or have smell sensitivities. There's nothing wrong with not having any color on your plate while going through treatment. It's hopefully temporary, and we just want you to maintain weight. And then finally, anybody suffering from swallowing problems like dysphagia, there are companies out there who take food like chicken or fish and breads and different vegetables and puree it down to a consistency that's appropriate for those patients. Swelling, otherwise known as edema or ascites, which is common in the abdomen, midsection. Recommending hydration, making sure that you are taking in enough fluid to kind of flush you out. And then, of course, avoiding sodium-rich foods, staying away from anything that is ultra processed, looking for reduced sodium options. Those things are important to consider. Hair, skin, and nails, especially the skin, the hot flashes and the sweating, avoiding spicy food, hot temperature food, even caffeine could be a problem for these patients. And then if anybody has pressure sores or pressure injuries, that's often seen in patients who are bedridden. Maybe they're hospitalized for a while and aren't getting up or being moved around a lot. Protein is very important. Bowel and bladder changes. Patients are constantly suffering from constipation, then diarrhea, and then vice versa. Once we fix one problem, the other one pops its head back up. So that's just kind of alternating fiber and fluid. If you're constipated, increase your fiber, increase your fluid to help soften the stool. Try to get in some physical activity as able. And if you're having diarrhea, the opposite. Low fiber, kind of follow that brat diet, bananas, rice, applesauce, toast. Some people say bratty and they throw in a Y for the yogurt and the probiotics, but also make sure you're hydrating because of the diarrhea. We want to make sure you're repleting any sort of electrolytes lost. And then bowel incontinence and bladder incontinence. Be careful with those acidic foods, caffeine, those are all irritants. So finally, some takeaways. In the beginning, if you remember, we reviewed, how supplements are regulated. So be careful when picking a dietary supplement. There are pros and cons to supplemental use before and during treatment. However, again, please consult with your doctor, your oncologist, your radiologist. We don't recommend supplementing. There are trials that are constantly being, conducted at MSK looking into this, but right now, the American Institute of Cancer Research also does not recommend it. So we kind of, follow through with their recommendations. And then most importantly, diet over supplements. Here are some resources I wanted to share. Our MSK website, again, it's open to the public, a wealth of knowledge, so much information, up-to-date research that we're conducting, really great stuff. We also do have a nutrition page, which highlights different recipes. So it's a great resource. The American Institute of Cancer Research, also tons of different recipes, but I tell my patients if they want to Google, do it on AICR's website because it's evidence-based and research-based. So there's no funny business on the website. Cook for Your Life is a great resource also for recipes. It's specific for patients and caregivers in the oncology world. So it's not only broken up by meals, but also divided into symptoms. So that's a really great resource for, anybody. And then finally, the FDA. Lots of information on that platform with supplements, regulations, things like that. Any questions?
We definitely did have some questions in the chat, and I just wanted to highlight, and Erin and I were kind of pinging a lot of the questions, especially pulling on the MSKs about herbs in the chat. So if anybody has any specific questions on herbals or supplements, I would recommend you check out the MSKs about herbs section, but also ultimately, like Alicia said, please discuss it with your healthcare provider first and foremost before starting taking anything. And so, yes, we do have a couple questions in the chat. First and foremost, early on, we had a question, just if you had any thoughts on multivitamins, because I know you were talking about supplements as far as adding and supplementing when needed, but what about like a multivitamin for somebody who maybe doesn't get a ton of variety?
Yeah, I don't have a problem with multivitamins. If you're going through active treatment, even with a multi, I recommend discussing with your doctor. But if you're a caregiver, like you said, maybe you just don't, love a ton of variety, a multivitamin is fine. Yeah, I don't have a problem with that.
Great. Awesome. And then I think we had a question too about estrogen. Do you want to bring that up, Erin?
Yeah, we get a lot of questions around supplements, herbs, botanicals that may mimic the effect that estrogen may have. Particularly, you can understand why this question comes up with our community and estrogen or hormone receptor positive cancers. So, what is your take on any sort of supplements or brands that may have a similar effect or may be effective in some of the side effects from medically induced menopause? What do you typically say, Alicia?
So with the hormonal cancers, our bodies can almost not entirely tell the difference, but I think that again, if you're questioning any sort of these supplements that mimic those hormones, don't take them. Eat the foods. Without knowing specifics, without knowing the, greater detail of the individual, it's hard to really say. Um, but yeah, that's kind of my feeling on it that, if you have any question or hesitation, especially with those hormonal cancers, whether it's breast, which I know obviously is the majority of our population here, but even prostate, which is also a huge cancer that has hormonal attributes to it, don't do it.
Okay. Have you found any supplements that may help with side effects relative to medically induced menopause that may be helpful? I know this is also so individualized, even in terms of what is effective or not, but
Yeah.
any thoughts on that?
Not really. I really haven't. And a lot of times patients will ask about their hot flashes. I've heard of X, Y, or Z, or, in my support group, somebody's taking this. So, first, again, it's where are you in your cancer journey? Are you, still on chemo? Are you just doing hormonal therapy? Consult with your doctor. But a lot of what I should have also mentioned is a lot of the interventions that I recommend to my patients who are going through active treatment. Unfortunately, these drugs are just so powerful that no matter what I suggest or whatever plan we come up with, I try to be as honest and realistic with my patients as possible that they might just trump whatever I can suggest. So I can tell somebody who's having hot flashes, stay away from spicy food, avoid the caffeine, stay away from hot temperature-wise food, and it might not make a difference.
Yeah, I love that. Any thoughts on supplements for some of the skin and hair changes that may come along as a result of chemotherapy or medications, or again, medically induced menopause? Anything that you might recommend? We've certainly seen some brands. I had a patient that was asking us today about a brand that might help her hair growth. What are your thoughts on that?
Yeah, I saw somebody actually just wrote something about Nutrafol. Patients always ask about biotin. When people are suffering from the hair loss for a variety of reasons, this is really where the nutrition plays an important role. Protein, as well as those healthy fats. Let's not forget the healthy fats. I think people still are scared of them, but they really are so important. But the protein as well, plant-based, animal-based, that helps with what's the word I'm looking for? Not reproduction, but the turnover of cells. So, you want to try to get that in to help with hair growth too. All of the other supplements that are out there, I think a lot of it is, commercial. I think a lot of it is, like I was saying, too good to be true. Just to touch on the healthy fats, I see somebody just asked, you can do avocado, you can do nut butters, whether it's peanut butter or almond butter. Olive oils, avocado oils, things like that.
Awesome. Yeah, we have a lot of questions, particularly on a lot of specific supplements and nutrients, which I think is a great opportunity to kind of do some of that research on the about herbs, talk to your
Yeah,
provider, just because, again, we don't all know necessarily everybody's scenario, right? Where are you at in your treatment journey and your diagnosis to make any broad statements about anything in particular with that. But Erin, did we miss anything more broad and general in the chat that you saw?
I don't think so. I really, just appreciate Alicia looking at the charts with known interactions between supplements and some of the individual chemo agents and medications. So I think, just being familiar with what's out there and understanding and speaking with your medical team about what patients should know about interactions, and even understanding what that risk looks like, affecting half-life of medications and efficacy of certain drugs. So I think that was all really, really helpful. But we've gotten so much. I think that you provided really great resources. We always say, do your own research, be a good student, but also connect with your team, even checking in with your pharmacist just to make
yeah,
sure, that you're crossing your T's and dotting your I's in terms of how you can safely add these in if needed.
exactly. Like I said, there's only so much that patients can control in this entire journey. So the things that you can control, my my feeling, my opinion, the evidence that I see really does suggest to kind of steer clear of them. There's just not enough research out there to make a strong case for supplementation for prevention and during. But that's the best part about nutrition. It's constantly changing and research is being, done on these topics. So it's exciting.
Yeah. And certainly we're so grateful to Sloan Kettering for also being at the forefront of a lot of that research.
Yeah.
And, even just having a big integrative space for patients across the country that may want to connect with professionals in the oncology arena. So certainly the work that all of you and your physicians and scientists and researchers do, we so appreciate that. And we appreciate your time with us this evening. So I want to keep to our time for the evening. I know we probably could chat for a whole other hour about this topic, but I want to be respectful. Know that I will pop Aubrey and myself up on here, but we will be, so tonight's her speaker series is recorded. It will be on our UFH Connect tomorrow. We will also be sharing this recording tomorrow on our Facebook page as well, because there has been so much interest. We'll make sure to include the resources that Alicia shared. So again, you can do a little bit of your own digging as you have those conversations with your medical team. And I think what I most appreciate about the talk tonight is don't forget to start with food and nutrition first, not leaning into supplements as a replacement for, but leaning into that food, especially in National Nutrition Month. So I appreciate that.
Definitely.
Wonderful. Thank you so much, Alicia, for being here.
Thank you guys. Have a great one and happy Nutrition Month.
Thank you. And thanks everybody for such a lively and engaging chat. We know that this was a very high interest tonight. And I even saw in the chat, someone said, please come back and do another one. So it was very helpful, I'm sure, for many folks. And thank you all for your engagement.
Yep. Wonderful. I do want to give a thanks again to our sponsors of our speaker series this evening. So tonight's speaker series was presented by West Merck and Daiichi Sankyo with additional support from GSK, Lilly, Gilead, Pfizer, and Agendia. We could not continue to bring these education segments to you every month without their ongoing support. So we are so grateful for that. And then don't forget about our remaining education events that we have coming up later this month. Very quickly, we have our speaker series next week, March 20th, 6 p.m., diving into EMDR. So if this is something that you have been looking to learn a little bit more about this type of therapy, we'll be doing a little practice together. Join us next week. And also we have our Ask the Expert, March 27th at 1 p.m. You are welcome to submit your own questions, talking all about breast implant safety and care with Dr. David Light. We are welcoming him back. So again, March 27th, 1 p.m. Eastern time. And I will let Aubrey once again share all of the fun activities that our dietitian team has for the rest of March.
Yes, and National Nutrition Month, we have so many highlights. And so make sure that you tune in every Friday on our Instagram at 10 a.m. Eastern time for our Dear Dietitian, where you can ask questions of our dietitian team live and we will be answering them. We'll answer about 2 to 3 each week. So be sure to submit your questions. You can submit them directly on our website, and we will be posting them to all of our social media channels after the fact. We also have all of our staff's favorite family recipes for our Food Connects Us theme of National Nutrition Month coming throughout the month. So be sure to check our blog because Sue and mine are already up. However, we have many other members on our team who shared their favorite family and friend recipes with everybody. So be sure to check out our Nutrition Hub, which is where you'll find all of our resources and recipes. But also, I did want to highlight, because I saw so many questions about specific side effects in the chat, is that we do have our very comprehensive nutrition side effect guide. It is over 60 pages talking about different side effects, from insomnia to weight changes to vitamin and mineral deficiencies, oral issues, GI upset. So please take advantage of that. It is free for you, available on our website. You can find it in our Nutrition Hub, but it also has its own special page. So make sure you visit our education dropdown for all of the information we have available. And thanks for tuning in for our National Nutrition Month, her speaker series on supplements.
Wonderful. So thank you for being with us. Thank you for all of your questions. And hopefully we will see you again in a future segment. On behalf of our entire registered dietitian team and all of us at Unite for Her, we're so grateful for you being here. Everyone have a wonderful rest of your night.
Thank you.
You're welcome. Thanks, everyone.
Awesome.
Great.
A lot of thank yous and a lot of love in the chat.
Yeah, love that. So good. All right. Well, thank you.
You're welcome.
All right. Very good. Well, enjoy the rest of your night. Take care,
Sounds
everyone.